Welcome to Nasdaq TradeTalks. I'm Jill Malandrino, global markets reporter at Nasdaq. Joining us for this segment, we have Othman Laraki, CEO of Color Health, to discuss the delivery of healthcare, navigating the economics of clinician shortages. Othman, it's great to have you with us. Welcome to Trade Talks.
Hi, Jill. Thanks for having me.
You got it. Color has built its business model around the delivery of healthcare. Can you tell me more about where Color is choosing to focus its efforts today, and what did your journey look like to get here?
Sure. Since its inception about 10 years ago, Color has been all about integrating different parts of healthcare the healthcare experience that should be made inexpensive and highly available, and really driving down the cost and increasing the accessibility of it. And so we did that with genetics. We did a lot of work during COVID around both immunizations, medication delivery, as well as vaccinations. And now we're focusing on cancer. But in all those cases, we've delivered about 40 million healthcare transactions to people all over the United States. And the main kind of common thread behind all of these have been focusing on services where you want to serve a very large distributed population. And the big challenge is to figure out how to make those services very cheap, very accessible to people in a way that's extremely simple and meets them on their terms, whether they're employee populations, school children, people in remote areas, workplaces, and so on. So it's really been about taking basic healthcare and taking it to people where their lives are actually happening.
Why did you decide to focus on cancer screening and prevention?
Yeah, so cancer is especially post-COVID now, is the most costly component of American healthcare. And it's the second highest driver of mortality in the United States. The cost of cancer is about 10x over the last 20 years. And about half of Americans receive their healthcare through their employer, through an employer-based plan. And with employers, they have very deep alignments, both obviously in terms of the human outcome of the populations they serve, but also a very deep economic alignment as well. And so we had this realization along with the American Cancer Society, and we started this partnership with the American Cancer Society. It's the first time they've done that in their 100+ year history, to provide a fully integrated service that is entirely designed to work with employers where they have coverage for cancer screening and prevention, but they often do not have the access and utilization. And so, for example, if you look at major cancers, like, whether it's like, breast cancer, colon cancer, lung cancer, people have now very good coverage for screening as part of their plans, but the utilization is very low. So, for example, lung cancer today, there's only about 6% of people who should be getting screened for lung cancer who actually do. And the gap in that screening, literally closing that gap, would have a bigger effect than any cancer therapy that has ever been delivered in the history of cancer, is literally just getting people screened. Because when you do, you catch cancers early and survival goes up literally almost an order of magnitude, and you save hundreds of thousands of dollars per person.
Can you talk more about how Color's cancer screening and prevention program works? How does it make it care more accessible and remove some of those barriers you mentioned?
Yeah, so it breaks down to three main components. The first one is screening access. So there's a set of screens that can be taken to the home. So for cervical cancer screening, colon cancer screening, and prostate cancer screening, those can all be taken actually to the home or to the workplace, where people can have very simple kits. That's what we've done it. Tens of millions of these during COVID, where we saw that when you take basic tests, get them to people in a way that's very simple, people are it's easy for them to use. Number two is for things where for screenings people need to go in person. We manage all the logistics involved around doing that. For example, mammographies, colonoscopies, and so on. That's the first part. The second part is around post-screening support. So when you find something in a colonoscopy, oftentimes people lose weeks or even months before follow-up, and that causes lives and costs a lot of money. So we have a service around that. And then the third component is around supporting people actually through the cancer journey, where there are a lot of opportunities to, again, like drive immediacy to access, shorten the time frames, and so on. And so that's really kind of like the full focus of the program is around managing the full scope of cancer for large populations.
What kind of reception has it gotten so far, and how can Fortune 500 companies implement something like this?
Yeah, so everyone wants to talk about how to address both the outcomes as well as the cost of cancer. Right now, all businesses are receiving the new rates for the new plan year for 2024, and everyone is literally freaking out about the cost. Even for Color, for example, Our rate increases have, depending on the plans, have gone from 15% to 33% in one of our plans. And the biggest drivers of that have been the GLP-1 drugs, so for weight loss and cancer. And so cancer is a place where there's a huge amount of agency and there's no good, fully integrated solution. And that's really where, people are engaging from, the largest companies, from tech workers, all the way to large industrial workforces and unions, all need to solve this problem.
Who are your competitors in this space and what differentiates your solutions?
Frankly, the real competition is the status quo. And the status quo really is the assumption that, we have coverage mammographies, we have coverage colonoscopies, then we've solved the problem. It turns out that, we haven't really solved that issue. And so I think really it's the assumption that, the current model works. That's the biggest competition. It's, and I think now we're seeing this happening across the board where major purchasers are dramatically changing their strategies because of the pressure. I mean, we've seen this, for example, the last few days around even selection of PBMs, with Blue Shield, that we're seeing these very major changes in how very large purchasers are choosing to, run their strategies. And so I think we're at the breaking point. So it reminds me of the Winston Churchill quote that Americans will always do the right thing after all other options have been exhausted. And I think we're at that point in healthcare here where, we have been trying this for the current model for 20 years and it has not worked. And so now is a time where I think there's enough pressure that we're really changing things.
And Othman, in the last minute here, how do you navigate the economics of clinician shortages and other factors that can impact how you deliver your service?
Yeah, I mean, so with clinician shortage, I think in many ways, it's when you have an open market, it is about how to utilize the supply more effectively. And so with this model, what we do is that we dramatically increase the leverage that we have on clinicians on staff by giving them tools that enable them to serve a lot more people much more efficiently. What causes a shortage is to have doctors who waste time by dealing with a lot of bureaucracy, dealing with billing, dealing with a lot of things that are actually not allowing them to practice at the top of their license. And so it's really a business model and a tooling gap that we're bridging for this type of service.
And finally, what can we expect from Color in 2024 and beyond?
I mean, from our perspective, right now, the way we look at this is how you start introducing the notion of value-based care into the employer model. And so we look at it cancer is the number one large rock. There are very similar dynamics in cardiovascular health. So I suspect we're going to be doing quite a bit of work on the cardiovascular side. Between those two, you're starting to edge up on almost over a third of total American healthcare. So that's really our focus is these really, really big problems, but where the solutions are already there, it's really about how to deliver them efficiently.
All right, Othman, we appreciate the insight. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thanks for having me.